Hello everyone, my name is Colleen and I will be your expert on language acquisition for tonight's Special Topics webinar. This evening I will be covering the topic of cochlear implants and how important the age of implantation is for language development. A cochlear implant is a small electronic device that helps provide sound to someone who is profoundly deaf. It is surgically placed under the skin and is made up of a microphone, processor, transmitter, receiver, and an electrode array. The implant is unable to restore normal hearing, but it does help provide a deaf person with a useful representation of sounds so that they can understand and perceive speech and other environmental noises. Some may think that a cochlear implant and a hearing aid are pretty much the same thing. However, these two devices are very different. Hearing aids help to amplify sound, while cochlear implants bypass the damaged portions of the ear to electrically stimulate the auditory nerve with electrodes. As I said before, cochlear implants are not able to restore hearing back to normal, but they allow someone with no hearing at all to understand the sounds of the environment. This can help them understand warning signs, follow a conversation, and even acquire language. While many with normal hearing would think that a cochlear implant would be a no-brainer, there is a very tightly knit deaf community that do not feel as if their deafness is a disability, and that they do not need to be fixed. Thus, cochlear implants are a relatively controversial topic, especially when deaf parents need to make a decision as to whether or not their child will be a part of the deaf community. However, cochlear implants are becoming increasingly more accepted now than ever. With all of that being said, many studies have been conducted to determine how important timing is in regard to cochlear implantation. It is known that being exposed to language as an infant is essential to language development. So, do parents who initially turn down cochlear implants for their children have time to change their minds? And if they do, how much time do they have? Well, most children who are born profoundly deaf or become deaf before the age of 3 fall significantly behind their normal hearing peers in their mastery of their oral language in the forms of writing, reading, speaking, and signing. In one study that analyzed age of intervention, 100 children were divided into 4 groups based on how old they were at the time of their cochlear implantation. For those who received their implant between the ages of 1, the youngest age possible, and 2.5 years of age, there was the largest benefit. These children had a large burst of growth that was not seen from the older ages, and they were also more likely to use their device for a longer amount of time. Ultimately, there was the greatest benefit for both speech and vocabulary outcomes when the children received their implants before the age of 2.5. So, in short, while a parent could ultimately change their mind and have their child receive a cochlear implant, the largest benefit comes when the implant is inserted when the child is under the age of 3. I know that was a pretty brief run-through of what a cochlear implant is and the importance of early implantation, so I would like to open up the lines for a couple of questions. Mary from Brookline has asked, what are the commitments that go along with getting a cochlear implantation? Other than the surgery, what does the patient need to do? Great question, Mary. Wearing a cochlear implant is a lifetime commitment. There is a lot of maintenance and care that goes into it, and there are many follow-up appointments, fittings, and annual checkups. There are also rehab services that the patient must go through. Children often need many years of extensive and demanding oral rehabilitation in order to get the most out of their cochlear implants. Alright, so our next question is from Tim in Buffalo. He said, "Hey Colleen, I heard you say that the implant is unable to restore normal hearing, but it can provide sound. So if it doesn't sound like normal, then what does it sound like?" Another great question. Thanks, Tim. So cochlear implants vary for each person, but they are commonly reported as being mechanical or somewhat robotic, maybe even a little bit staticky. However, over time, and with the help of the rehab services, the sound quality will change as the brain relearns the stimulation patterns from the implant. This can usually take from about 6 months to a year. Alrighty, well with that we will wrap up this week's Special Topics webinar. I'd like to thank the New York Times for having me on the show and all of you for tuning in. Bye now.